Hello, and welcome to Kashi Clinical Laboratories Cardiac Health Panel Provider Training Webinar. My name is Dr. Corey Edwards. I'm a licensed naturopathic doctor in the state of Oregon. I'm also adjunct faculty at the National University of Natural Medicine, also Oregon College of Oriental Medicine, where I teach genetics and pathology. Kashi Clinical Laboratories is a fully accredited laboratory in all 50 states, including New York, California, and Florida. We are also able to provide services internationally. At Kashi Clinical Laboratories, we are led by Dr. Kashi, who is a brilliant, dedicated, and respected scientist. She has worked hard to create an excellent facility that providers can trust. The numerous advantages to using Kashi Clinical Health Laboratories as your testing laboratory include non-invasive cheek swabs, fast test results, all testing is done in-house, we are accredited in all 50 states and internationally, comprehensive, easy-to-read reports, HIPAA-compliant electronic reporting, easy electronic payment options, wholesale volume pricing, and genetic test panels that are clinically relevant. Cardiovascular disease is common in the general population, affecting the majority of adults past the age of 60 years. In 2012, cardiovascular disease was estimated to result in 17.3 million deaths worldwide on an annual basis. The team at Kashi Clinical Laboratories has compiled research on these 8 genes and found them to be strongly associated with different aspects of cardiovascular disease. The Kashi Health Cardiac Panel consists of the genetic markers called 9p21, AGT, eNOS or NOS3, MTHFR, Factor II, Factor V, ApoE, and SLCO1b1. Each of these markers are involved in the development of cardiovascular disease by affecting the health of arteries, blood pressure, inflammation, clotting, drug metabolism, and lipid and/or cholesterol levels. (9p21) is associated with cell proliferation in the coronary arteries by increasing the expression of CDKN2A/B, which is a tumor suppressor gene. Studies have shown that even carrying one of these genes can increase your risk of cardiovascular disease by 25%. Angiotensin is produced by the AGT gene. It is the precursor to the active peptide angiotensin II. This hormone causes vasoconstriction of the vascular system. Evidence shows that a variant in the AGT gene causes an increase in vasoconstriction and is associated with poor cardiovascular health. Endothelial nitric oxide synthase is a key enzyme responsible for maintaining vascular nitric oxide levels. Nitric oxide causes vasodilation, which lowers blood pressure. Individuals with eNOS or NOS3 variant may have an increased risk of ischemic heart disease, stroke, and myocardial infarction in young patients. Certain alleles of the MTHFR gene can result in increased homocysteine levels, which is an independent risk factor for ischemic stroke. Testing and treatment for this genetic marker can greatly benefit the patient. Factor II prothrombin is involved in the clotting cascade. Variants of this gene can cause a 2 to 3-fold increase in the risk for developing thrombosis and venous thromboembolism. Factor V encodes for a protein which is involved in coagulation. Certain alleles of this gene can cause prolonged activation of factor V and consequently lead to the increased risk of clot formation. ApoE is a glycoprotein involved in the transportation of cholesterol and lipids to various tissues. There are three major alleles, E2, E3, and E4. People who have the E2 allele can have lower cholesterol levels. However, in rare circumstances, they can develop a condition called hyperlipoproteinemia. E3 is considered the normal variant that is not associated with an increased risk. E4, however, is the risk allele and is associated with an increase in blood LDL levels and triglyceride levels. SLCO1b1 gene encodes for a protein that affects the liver's absorption rate of many drugs, including statins. People who have this variant allele have reduced uptake of certain statins. This will decrease the efficacy of the statin drug within their bodies. Patients that are strong candidates for genetic testing will be the ones that are resistant to the effects of hypertension medications, have poor control of their cholesterol despite treatment, patients who have a personal or family history of increased clot formation, and lastly, young patients showing premature signs of cardiovascular disease. Kashi Clinical Laboratories uses a variety of molecular biology testing techniques, including Luminex, real-time PCR, Sanger sequencing, and next-generation sequencing. Genetic testing can help with the management of patients in many ways. It can help a practitioner quickly assess the patient's need for increased monitoring and surveillance. One of the biggest advantages to genetic testing with Kashi Health is our quick, easy, and painless sample collection kits. All that is required from the patient is a quick cheek swab that can be performed in office. This testing method is great for patients who are afraid of needles, hard to draw blood from, or for the younger population. The first step to getting started with genetic testing is signing up as a provider at kashihealth.com. After you have done that, you can request kits and get started testing. After you have returned your first sample, you will receive a free consultation with a clinical consultant, such as myself. In addition to checking out our website, please feel free to contact the Kashi Clinical Health Account Manager, Vivian, directly through email, or you can contact our customer service, either through email or telephone. Thank you for taking the time to learn more about genetic testing. We look forward to hearing from you.